Hi, this is Jenny, and I'm going to be talking about panic disorder. This is very relevant to what we are learning for our psych mental health nurse practitioner certification. We will see panic disorder multiple times through our profession. I'm going to talk about the background, the causes, the DSM-5 diagnosis criteria, symptoms, and treatment methods. As far as the background, it was coined as a DeCosta syndrome during the American Civil War, named after Dr. DeCosta. Another term would be irritable heart syndrome with men coming back from the American Civil War. In 1895, Freud coined it anxiety neurosis, which stayed that through the mid-50s, 60s until anxiety and panic attacks came more of a term. And in 1980, it became part of the DSM-3. Women are 2 to 4 times more likely than men to have panic disorder, and the mean age of onset is 25, although it can happen and come about at any time. 91% of those with a panic disorder have another form of anxiety and or depression. As far as causes, there's some biological factors that include the central nervous system dysregulation, our noradrenergic system in our brain, as well as norepinephrine, serotonin, and GABA receptors that are responsible. There's some panic-inducing substances that can cause panic attacks, panic disorder, which include caffeine and other medications that are either GABA receptor antagonists or alpha adrenergic receptor antagonists. Brain imaging findings have showed there's some pathological involvement in the hippocampus and amygdala and the temporal lobes. And first-degree relatives have a 4 to 8-fold higher risk of having panic disorder, as well as psychosocial factors which have a huge impact. And it's usually triggered by stressful events, although the panic attack usually will come out of the blue. But looking back and doing a history, they've had some sort of loss in themselves with a family member or anything in their life. If you can see these symptoms on the right side, we must make sure that there's no other comorbidities. So this is a diagnosis of exclusion. Again, this is a very fearful type of disorder to have. Patients think that they're dying. They think they're going to pass out. They run out of the room. They want to run to safety. You have to meet at least 4 of the 13 criteria here. Have it, this panic attack, and then have 1 month of fear of having another attack. Also, you have to make sure you exclude any other issues such as drug or other types of medical issues, including thyroid, hypoglycemia, seizures, drug withdrawal, illicit drugs, asthma, cardiovascular disease. There's a high risk of suicide also with panic disorder. Treatment, first-line treatment is SSRIs. Fluoxetine, paroxetine, and sertraline are FDA approved, although some other SSRIs are also utilized, but these are FDA approved and have been studied. Venlafaxine is another option. Another thing you can do is couple it with the benzodiazepine while they're getting on the SSRI. Also be really careful because we know about addiction, and you must wean the patient off or the person off of benzodiazepines. If these don't work, then clomipramine is also another choice. MAOIs, phenelzine has been studied, although not given as much anymore due to the interactions. If they're treatment resistance, you can also augment with other medications such as hydroxyzine, propranolol, buspirone. You may have to switch medications or try a combination. Sometimes we do a tricyclic with an SSRI, although it's more uncommon to do that. It's best to do it with a combination of cognitive and behavioral therapies, with CBT being an important part of panic disorder treatment, as well as exposure therapy. But we're now moving towards a lot of holistic approaches such as meditation, exercise, yoga, biofeedback, and deep breathing, the 4 to 8 ratio. You breathe in for 4 and you count down out to 8. It's known that with a panic attack, you're triggering the carbon dioxide drive and you tend to retain it. So blowing that carbon dioxide will help. There's also a link for resources through the NIH here. And that is it. Here's the reference page that references everything that I used, and I hope you learned something. Thanks.